I hope our guests are comfortable. You are very welcome. In case more comes, our staff will help you with more chairs. As we welcome you, this is our chamber, but we have to share. Thank you very much. Honorable members, I will now ask the secretary to read the order.
Debate on vote number 18, health.
Thank you. As we welcome the Honorable Minister of Health, Phaahla Hlabirwa.
Thank you very much, Honorable Chairperson. Greetings this morning to my colleague, Deputy Minister, Dr. Lomo, any colleagues, ministers, deputy ministers present, colleagues, MECs from various provinces. Thank you very much for joining us on this budget vote for today. Chairperson of the Portfolio Committee on Health, Dr. Jacobs, and members of the Portfolio Committee present, all the honorable members of the National Assembly, ladies and gentlemen. Let me thank the Speaker for the opportunity for us this morning to present the Budget Vote 18, the Budget Vote for Health 2023-2024. Our budget vote takes place just 5 days after the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, announced that the International Health Regulations Emergency Committee in its meeting of the 4th of May, 2023, had come to the determination that COVID-19 no longer constituted a public health emergency of international concern. This was determined on the basis of declining infection rates, hospital admissions, and deaths. The WHO had declared COVID-19 as a public health emergency of international concern on the 30th of January 2020, and subsequently declared it as a pandemic on the 11th of March 2020. The lifting of the public health emergency of international concern status of COVID-19 brings us closer to the end of the most devastating global health emergency in over a century, since the Spanish flu of 1918. What this means is not that the virus and the disease are over, but just that it has become more endemic. It is still a high risk for vulnerable individuals, especially those of advanced age and also with comorbidities. It is therefore still advisable that those of us in these categories, including those who are also immunocompromised, should get our boosters every 6 months on average. I want to take this opportunity to thank all those who played a major role in saving lives at the peak of the pandemic. We thank our health workers who stayed the course even at times when everybody else was staying at home. We thank our scientists and researchers, those who availed themselves to serve on various ministerial advisory committees. I also want to take this opportunity to thank our business, labor, civil society, religious and traditional leaders who helped to stabilize society and promote vaccination. Who can forget the fact that at the peak of this, when we had all the lockdowns, big churches in my own province, like the ZCC church, stopped all its congregations, even including during Easters. Lastly, I also want to thank our leader, the President Ramaphosa, for leading a whole of government and also a whole of society response, but also not only in the country, but also in the continent and in the world. Our task is now to join forces with other players in the world in getting ready for future pandemics, because we have been forewarned that this is not the last pandemic. Honorable Chair, our budget vote takes place at a time when our country's economy is not performing well, following the COVID-19 pandemic and now being also under load shedding. The financing of public health is seriously negatively affected by this situation. The 2023-24 budget allocation for our department shows a decline of 4.4 billion rand from 64.4 billion in 2022-23 to 60.1 billion in 2023-24. Even though the 4.4 billion decline can be attributed to discontinuation of conditional grants which were allocated for the fight against COVID, including vaccination, the fact of the matter is that there is not even inflation adjustment, and there's also reductions in some of the key programs. National Treasury itself acknowledges that the health sector is underfunded at a conservative estimate of around 11 billion rand, but we believe cumulatively, due to many years of budget cuts, that the underfunding is much higher. 89.2% of our budget is transferred to provinces, and in the current budget, the transfers and subsidies to provinces account to 56.2 billion out of the 60.1 billion rand. 10 million rand per year over the next 2 years will go to the no-fault compensation scheme to cover adverse events after COVID-19 vaccination. Notwithstanding all these challenges, Honorable Chairperson and members, we have made significant progress on various fronts. Over the last 10 years, there has been a significant increase in the training of medical doctors by our medical schools, and also added to this, graduates from Cuba. As a result, the number of medical interns increased from 1,500 in 2015 to 2,625 in 2022, while medical ComServe community service doctors increased over the same period from 1,322 to 2,369. The problem is that on many occasions, our provinces have not been able to be absorbed in post due to financial constraints in our provinces. We are working with the South African Medical Association Trade Union to make sure that doctors who want to work in the public sector are assisted to get a post. Over the MTF, 7.8 billion has been allocated to support provinces for absorption of interns and community service doctors. A further 8.7 billion rand within the medium-term budget framework, also in the HR grant, is allocated for specialist training. Nursing colleges in all provinces are implementing the new curriculum. South African Nursing Council and the Council on Higher Education are finalizing agreement on the articulation of previous diplomas into the higher education curriculum so that they can qualify for postgraduate studies. A human resources plan has been finalized and is being regularly reviewed and costed. The challenge being continued reduction in funding. Currently, we are concerned that the 2023 salary agreement is expected to be funded from savings, meaning that it expects that there should be a reduction in headcounts when we are already indicating that we need to employ more, especially on the front line of health services. On infrastructure, Honorable Chairperson, our exit out of COVID-19 as a health emergency and pandemic enables us to focus on improvement of services from the primary health right up to specialized care. A key ingredient for that is a suitable infrastructure. It is common cause that many of our facilities need attention for maintenance, refurbishment, upgrades, or replacements, but we also need new infrastructure. To support provinces in this regard, we have been allocated 7.2 billion rand per year over the next 3 years for direct transfer to provinces based on approved plans. Also, under the NHI grant, we also are able to support provinces with a budget of 1.4 billion rand, which is implemented as an indirect grant managed by the National Department on agreed projects in provinces which cover from primary healthcare right up to tertiary level. The implementation of the Limpopo Academic Hospital, which will start later this month, all procurement has been done, contractor has been appointed, and the site handed over. So they will work on the ground, will start before the end of May, also falls under this allocation. Also in Limpopo, the Siloam Hospital is already over 10 months in construction, and in the Eastern Cape, Zitulele and Bambisana hospitals are also already under construction. And so in the Free State, the Tlhabeng Hospital, a number of community health centers and clinics are also be funded either under the direct grant or the indirect grant to be able to upgrade their facilities. Still in Limpopo, over the next few months, we'll finalize plans and allocations for Chilizini Hospital and also Elim Hospital. I can, let me say upfront, Honorable Chair and members, that the funding of the Limpopo project is not because it's my province and it's not because the MEC is here. It's just that it's one of the provinces which have suffered over many years of underfunding and underinvestment. So we are focusing on all the provinces which have been disadvantaged over many years. Our infrastructure team has been instructed to look at ways in which we can reduce the delivery timelines and also reduce cost of implementation without compromising on quality. We're also looking at alternative methods of funding to increase the pace and scale of infrastructure delivery. Acquisition and maintenance of equipment is also under the spotlight, where we are also looking at faster turnaround times and reliable maintenance plans for our health infrastructure. Honorable Chairperson and members, primary health care is at the center of improving access and quality of health services. To drive towards making all our primary health facilities attaining ideal clinic status was in a way derailed by the pandemic, but is now gaining momentum. In the 2023-24 financial year, we expect 200 more clinics to attain ideal status, bringing the total to just over 2,400. And we want to increase the pace in outer years so that all the over 3,000 clinics can become ideal. To improve patient records management, the HPRS has been rolled out in 3,211 clinics, out of which, in fact, 3,211 public health facilities, out of which 267 are community health centers and 2,870 are clinics and 74 are hospitals. Building on the learnings from the development and rollout of the electronic vaccination data system, we will this year introduce the first module of the electronic health records focusing on HIV and TB. Our team is working with all provinces to make sure that ICT support is given, including connectivity in the remaining clinics which are not yet connected. Emergency medical services is an important component of primary health, and therefore we are assessing all provinces for compliance with medical emergency service regulations. One of the issues which we have to sort out with the colleagues in National Treasury is the transversal contract for acquisition and maintenance of vehicles, which also affect our ambulances, which result in our ambulances taking long before, firstly for purchasing, long time, and also when they must get repaired, the process takes too long, and many of the ambulances stay long in workshops. We currently, Honorable Chair, have just under 50,000 community health workers in service, and we are aware that we need to increase, we need to add more community health workers. Our HR team is working within the Public Service Bargaining Council to find a lasting solution for long-term or permanent engagement of community health workers. Hospital services are also key to improvement of quality health services, because that is where we end up when prevention and early treatment has not succeeded, and therefore when we are at our most vulnerable state. It is therefore not surprising that when something goes wrong in hospitals, it drives a lot of anger and emotions. Over and above infrastructure, equipment, and staffing, there are other factors which determine the quality of care at hospitals. Performance in areas such as record management, management of linen, and medical consumables. But of course, in some hospitals, as has happened also in Gauteng province recently, even the provision of food can also become compromised in terms of quality. Overall, central to the efficiency of hospital management is the competent managers with support of the provincial officials. We should be able to revive the Albertina Sisulu Health Managers Training Program, which played a major role in improving quality of our managers. Properly managed referral systems are also important in terms of making sure that we can have efficiency. The tertiary services grant in 2023-24, which is at the amount of, in this financial year, 14 billion rand under the tertiary services grant, is used as a subsidy for highly specialized medical services, which are provided in 31 tertiary and central hospitals, mostly in urban areas. They are assisted for referral services from district and regional hospitals. The grant is also used to build capacity to reduce long-distance referrals, such as in oncology. And in this regard, we are assisting Mpumalanga province and Limpopo province to build their oncology capacity so that they should not be referring all their patients to Gauteng. Honorable Chairperson, we have made significant strides on our fight against HIV and AIDS, TB, and STIs. But COVID-19, again, also in this area, caused some significant reversal in some of our gains. We have not been able to attain the 1990 targets, which was agreed upon by all countries under the auspices of the United Nations, under the UN-AIDS. The current global target for 2025 is 95, 95, 95. And in our country, we are currently at 94, 76, 92, which indicates that our biggest shortfall is in the middle 90, which is that of getting all the positive people who have tested positive, make sure that they are on treatment. All provinces have reached their first 90. In other words, 90% of those of the population knows their status, but only 6 districts in our country have reached the middle 90, that one of putting 90% of those positive on treatment. 4 of these districts are in KwaZulu-Natal, 1 in the Free State and 1 in Mpumalanga. We have developed an acceleration plan which identified 100 facilities in 17 districts in the 9 provinces with a high burden of HIV and AIDS. By focusing on these areas, we hope to reach the 95 by 2025, and also the elimination of HIV and AIDS as a public health threat by 2030, as in our national development plan, but also as the target of the UN-AIDS. A major challenge for our country remains new infection of young people, especially adolescent girls and young women. Through our youth prevention strategy, which was launched by Deputy Minister Jomo during the course of last year, termed Zikhala Ganjani, we hope to reduce the HIV and STI for 15 to 24 years age by 40% by 2025. To increase efficacy and viral suppression, we have also introduced new drugs such as TLD, made them more accessible to adults and adolescents, which are also safer and more effective treatments. A very effective treatment also for children, child pediatric, DTG, has also been approved by SAPRA. All these medicines will increase safety and efficacy in the management of HIV and AIDS. TB also is the twin infectious disease with HIV, which causes a lot of high mortality in the world and also in our country. Similar to HIV and AIDS, we also lost some ground in the management of TB, but we have approved our recovery plan to make sure that we can be able to recover. We are targeting to reach 90% of success in treatment, but currently we're just under 80%. And through our recovery plan, we hope that we'll be able to reach this. Also, I can also indicate that through also new treatment regimens, shorter treatments, for instance, for drug-resistant TB, in the past, it used to take 2 years to treat drug-resistant TB, but now with the new regimens of treatment, this can also has been reduced from the previous 2 years and then 9 months. Now we can treat for 6 months. And also there are new regimens also for children, which can treat TB for 4 months. On malaria, we are on course and we're working with our neighbors to make sure that we can indeed reach our malaria elimination. Some few months ago, there was also cholera outbreak, still on the infectious disease. I'm happy to announce to the House that this has also been contained. We have not had any new cases over the last month or two. The measles outbreak, We have rolled out immunization programs throughout the country, and the measles outbreak is also fairly under control. The other area which also suffered as a result of the COVID-19 pandemic, Honorable Chair, is the area of reproductive health. And as a result, family planning services were reduced. And because of this, we have seen a high rise of teenage and school pregnancies. And with our recovery of family planning, we hope that this also can be reduced. Honorable Chair, as I come to the end, the National Health Insurance, we know that the bill on NHI is in this House, and we want to urge all members, irrespective of political party affiliation, to support the approval of the National Health Insurance Bill, because this is all about equity. This is all to make sure that we can break the barriers of the two-tier health system, make sure that you can pool resources, and make sure that everybody in our country can receive adequate health services without having to pay at the point of delivery. That is really the essence of the NHI. And we are busy in the meantime within the department, making sure that we are laying the foundation through various ways. Honorable Chair, as I thank you, I want to say that as we move towards 30 years of our freedom and democracy, let us all commit towards progressive realization of our aspiration of our constitution to provide health services for all our citizens. I thank you.
Thank you, Dr. Pasha. We will now welcome the chairperson of the COM Sub-Portfolio Committee, Dr. Jacobs.
Thank you, Chairperson, Honorable Minister, Deputy Minister, fellow members of the Portfolio Committee on Health, and all other members present. Health is a critical provision which is enshrined in our Constitution and is a basis of sustenance of life itself. It is this basis which places Budget Vote 18 as a critical vote as it speaks to the well-being of all South Africans. Healthcare costs affect the economy, the national budget, and virtually every South African family's financial well-being. Good quality, accessible healthcare enables children to excel at school, adults to work more productively, and South Africans of all ages to live longer, healthier lives. Healthcare is not a privilege for a few, but a right for all. Investment into the public health system is oftentimes seen in isolation, not taking into account the impact of health on the economy and society. The COVID-19 pandemic has proven how important health is for all aspects of the economy and society. South Africa needs to develop a resilient health system, better able to deal with the multitude of challenges we are presented with. We attended the Presidential Health Summit last week as the committee. It was quite encouraging to see how the health sector is engaging with the challenges confronting it, both the public and the private sectors. Most encouragingly is the willingness of both sectors to work together to achieve the key priorities and interventions for 24 to 2029. And this is across all 10 pillars. I'm going to mention just a few of these important points. The first is addressing the challenges of human resources of health. 2 is improvement of supply chain management. 3 is fighting and combating corruption. Let me just see what's happening with my laptop. Oops.
Earlier on, I realized that the network in this room is not so strong, Dr. Jacobs.
Thank you.
I will just advise other members to try and print their speeches because they might have disappointments. Proceed.
Execution of the infrastructure plan with recommendations to the National Treasury to implement the infrastructure development management system framework. Improvement of the quality, safety, and quantity of health services provided with a focus on primary health care. Then the development of a digital health governance framework and strengthening of accountability mechanisms at national, provincial, and institutional level. No debate is complete without mention of health reform. Now, health reform is for the most part governmental policy, but it affects the healthcare delivery in any given place. Just to mention a few things which I mentioned as improvements for healthcare reform, it's access, coverage, quality, safety, efficiency, effectiveness, equity. Our intention is to achieve this improvement through the implementation of national health insurance, the work on the legislation on the NHI bill is at an advanced stage. There had been hiccups, for example, the COVID-19 pandemic and other, but the Portfolio Committee has been committed to finalizing the bill. And we hope to have the B bill, which is the final bill adopted by the Portfolio Committee on 24 May 2023. Thereafter, the B bill goes to the House for adoption, after which is referred to the NCOP for concurrence. The presented budget vote has highlighted the importance of strengthening the quality of care that should be provided in our facilities. This includes, but it is not limited to, ensuring that there is the requisite support for clinicians in our facilities in terms of both infrastructure and human resources. As part of the transformation agenda, the budget vote addresses the issues related to accessing quality healthcare by, for example, bringing tertiary services closer to patients in areas where these services are comparatively underdeveloped, including in the Eastern Cape, Limpopo, Mpumalanga, and Northwest. This is necessary and will address the issues of access as well as better manage provincial hospital referrals. We note with concern the reduction in the budget of the National Department of Health in this financial year, a decrease of 6.9% in nominal terms and an 11.2% reduction in real terms. The Financial and Fiscal Commission highlighted the decrease in the number of posts for doctors and specialists compared to 4 other countries, which included the UK, India, Mexico, and Brazil. South Africa had the lowest number of doctors per 1,000 patients, and the ratio has declined over the last few years from 0.79 doctors per 1,000 patients in 2019 to 0.32 doctors per 1,000 patients in 2022. Now, we know that 8.7 billion rand is allocated over the medium term to the Human Resources and Training Grant to supplement provincial funding for doctors to pursue specialist training. Yet we see there's an estimate of approximately 54% decrease in registrar posts, Honorable Minister. Equally concerning is the challenge of non-clinical posts not being filled and even frozen. We've seen this in the Eastern Cape, and this is important work that often gets taken for granted. It is easy to assume that cutting a non-clinical position, we are saving much needed money. However, the reality is that, for instance, a porter, when a porter is not appointed, it would mean that a nurse or even a doctor would have to push the patient around, and we need this to be addressed very urgently. The AG noted a number of material irregularities across the various provinces. Many times these issues were not finalized as court processes will be initiated. It's important that all provinces deal with the material irregularities and institute a program to prevent these from occurring in the first place. Regarding the APPs, it is very concerning that the AG had negative findings on measurability or usefulness, as well as completeness of indicators in certain provinces during the national, including the National Department, must become a matter of process, that the APPs are resubmitted to the AG to ensure that the proactive review is correctly implemented. It's also concerning that key indicators and targets from the MTSF are not tracked in the APPs. How would the department know if they're on track to meet the target in the MTSF if it is not tracked and reported on? This needs to be rectified as a matter of priorities. In terms of NCDs, having a negative impact on the health outcomes in the country, we therefore welcome initiatives such as the My Body, My Health, My Wealth campaign to address NCDs in South Africa. Furthermore, the committee will be monitoring the implementation of the National Strategic Plan on NCDs. Globally, South Africa rates among the 5 countries with the highest burden of HIV infections. Also noticeable, all top 5 countries with high HIV rates are in the Southern African region. However, the increase of ART coverage in the region has contributed to greater life expectancy and quality of life. Among the top 5 countries with high HIV rates, South Africa has the highest ART coverage. The South African government contributes 40.4 billion rand funding for HIV/TB response, with international donors contributing 11.3 billion rand, totaling 51.8 billion rand for HIV/TB response. It is, however, projected that over the MTF donor funding will stagnate or decrease, while government funding will steadily increase. Maternal, infant, and child mortality is an important indicator in the health system. We note the International Maternal Newborn Health Conference currently taking place in Cape Town, which the Minister will be opening today, from the 8th to the 11th of May. More than 1,500 international stakeholders congregate to improve maternal and neonatal survival and prevent stillbirths. We are confident that many innovative and important developments will emanate from this important conference, and we congratulate you, Minister, on this conference taking place. In conclusion, Chairperson, the ANC supports all efforts towards health system strengthening. We believe that the National Health Insurance remains the only vehicle that will assist in addressing the issue of health equity in South Africa. As servants of the public, we owe it to South Africans to ensure the passing of this bill in the remainder of this term. It is indeed the only way we can advance universal healthcare in a just and equitable way for all South Africans. The ANC supports the budget vote of the department. Thank you.
Thank you, Doctor. May I now recognize the Honorable Clerk?
Good morning, Chairperson, and good morning to all the members. Patients are forced to suffer because government is unable to address the multiple failures of the South African public health system, including the lack of funding, poor staff morale, and low staff-to-patient ratio. The failures are rooted in dereliction of philosophy and ethics of Ubuntu, including poor management, and in many instances, due to cadre deployment. The NHI will not be the alpha and omega quick fix to the myriad of problems faced in the public health system. Urgent intervention is needed to supply quality universal health care to the citizens of this country. The ANC has constantly stated that South Africa does not have universal health care. It is ironic that the ANC has been in power since 1994, yet they openly acknowledge that they've done very little to ensure that South Africans have quality UHC. Despite repeated promises and plans to improve public health systems these past 3 decades, it has come close to ruin under the ANC government. Hospitals and clinics are falling apart, and this government has done nothing to ensure the citizens of this country's constitutional rights to quality healthcare. There is little to no consequent management for corruption and financial mismanagement. There are severe staff constraints, facilities and equipment are not maintained or upgraded and are often unsafe. For nearly 30 years, the ANC government have barely done the minimum to ensure healthcare. Of quality, we don't even speak. How do you envision complying in terms of the required regulations stipulated within the NHI bill? When maladministration, fraud and corruption eventually leads to investigations, recommendations are never implemented, and the situation continues to deteriorate, as seen recently with the Rahima Musa Mother and Child Hospital in Gauteng. Pleas for help and interventions are simply ignored. The public health sector is riddled with corruption. We have seen a minister's close friends and families profiting from COVID-19 and PPE funding. Whistleblowers are being intimidated, silenced, and killed. In the budget realization, there are a number of targets and indicators relating to mother and child mortality, but the efficacy of those programs need to be better reported upon. Infant mortality rates rose sharply from 2020 to 2021. The same increased trend can be seen for mortality in children under 5 years. These trends show that we might see an increase by the end of the year. This indicator in the budget needs serious adjustment and realignment. A recent question to the minister revealed that 178,445 children aged 0 to 5 years died in public hospitals in the past decade. 12,582 from moderate and severe acute malnutrition. Thousands of babies die in hospitals annually due to poor infection control, limited neonatal beds in ICU, delays on case management, hypothermia, and staff that do not have adequate training. Diabetes has doubled in South Africa in the last decade. 4.2 million people have diabetes in our country, and around 45% of people are underdiagnosed according to the Diabetes Foundation. So the number could be as high as 9 million. South Africa has one of the highest obesity rates in the world, which could lead to a range of other diseases, including hypertension and diabetes. According to a health study, 8.2 million South Africans dependent on public health care suffer from hypertension, which is the root cause of heart diseases, strokes, and kidney diseases. According to a question submitted to the minister, only half of the allocated 48 million of the health promotion levy raised was spent, which begs the question, Mr. Minister, with lifestyle diseases on the rise, why was the full amount not spent? Cancer is one of the leading causes of mortality in the country, accounting for 10% of the nation's deaths. There's an urgent need for the public health sector to implement and fund cancer prevention strategies in order to reduce the burden on the health system. Government has spent more than 2.3 billion rand on legal costs for medico-legal claims since 2018. With reports that legal professionals sometimes collude with medical personnel and doctors to obtain patient files and also file fraudulent claims. A total of 15,148 claims have been lodged. It is worth mentioning that the department had an under-expenditure of 771 million rand and underspent 82 million rand on health systems and human resources, despite the significant staff shortages. Many hospitals lack basic ICT infrastructure. Many do not have working telephones or computers, never mind Wi-Fi. The department has put a plan in place to implement an e-system at the cost of 1.5 billion rand over 5 years. This indicator will be closely monitored to ensure this outcome is realized. The severe nursing staff shortages in the country, between 26,000 and 62,000 public and private nurses, are a major risk to the health system in South Africa. Yet, despite all the staff shortages, the department spent 30 million on just 44 posts for NHI. During the Presidential Health Summit, the private sector mentioned that they have the capacity to train specialized medical personnel, but is hampered by legislation. This is one of the health compact indicators that was not realized since 2018. It is clear that almost no progress has been made on the Presidential Health Compact since 2019. The lack of progress on the compact is a clear indicator of what will happen with the NHI. Clear goals on paper, but no political will or expertise to implement. And I see the DMs looking at me. We had this discussion on Friday, and he disagreed with me. In conclusion, who has health has hope, and who has hope has everything. The residents in this country have no hope under the ANC government and very little to celebrate. I thank you.
Thank you. The Honorable Shira.
Greetings to the Commander-in-Chief of the EFF, Julius Sello Malema, the Deputy President, Nyuko Shivambu, the officials, commissars, and ground forces of the Emancipation Movement. 2023 marks a very special year in South African and global politics. The 26th movement, the economic freedom fighters, 10 years old. It has been 10 years of fighting for free quality healthcare, commitment to healthcare workers' struggle for better employment conditions, 10 years of unbroken commitment to the fight for 24 hours clinics. And as we celebrate the 10-year anniversary of the only organization that belongs to healthcare workers, the EFF, we like to invite all nurses to come and celebrate with us at FNB Stadium. We also invite them to donate to the only organization that is not funded by the Ruperts and the Oppenheimers. To donate to the EFF, you simply send EFF donation to 38172 and you will donate 10 rand. You can donate multiple times as there is no limit. The Ramaphosa administration is by far the strongest demonstration of the allegiance of ANC towards the establishment. Many thought that the CODESA negotiations were the height of selling out. But today, I give you the Ramaphosa presidency. The private sector is seeing the biggest show of loyalty from the ruling party because of little Manel, the ice boy of the Oppenheimers and the Ruperts. It is now evident that the sole purpose of the Ramaphosa presidency was to take money and assets out of the state and plant them in private white hands. State-owned entities, the sellout expropriation bill, and of course now the NHI bill, which is tangible evidence of what President Ramaphosa came to do, to sell our country to the highest bidder. Like the expropriation bill that stole the language of revolution to mask its true destructive nature and intention towards state sovereignty, the NHI bill does the exact same thing, selling equalized healthcare and a breakdown of a two-tier health system in rhetoric, while it is in fact the outsourcing of healthcare to the private sector. And like with the SOEs, ESCOM, SAA, Transnet, Denel, we are seeing the real-time intentional collapse of the public healthcare system. Minister Joe Pasa, like Minister Pravin Gordhan, has no shame that the public healthcare sector is at its worst status this country has ever witnessed under his stewardship. This because he is achieving the mandate Bill Gates gave to the ANC in the year 2009, where he told the ANC at a private conference to implement the NHI. Patients die at the gates of hospitals. Newborn infants die in their hundreds in hospitals like we saw in Chris Hani Paraguanas. Thousands of young mothers are raising permanently paralyzed children because of avoidable negligence in our hospitals. Healthcare workers are overworked and underpaid. Ambulance services don't exist. People don't even call for them anymore because they simply don't show up. Money meant to improve infrastructure of our hospitals is put into the pockets of ANC gorgons like we saw in Tembisa Hospital. Surgery backlogs are overlapping for years. Many patients dying, awaiting their chance at life-saving surgeries and treatment. Thousands waiting for their wheelchairs for many years on end. The solution to our public healthcare collapse crisis will never be that we tenderize healthcare and outsource the well-being of our people to Netcare and Life through the NHI. Netcare and Life don't even have branches in township and rural areas. Prioritize primary healthcare, prevention and education. Increase and fill out all vacancies of healthcare staff. Ensure that there is at least one healthcare facility in every ward across the country that is open for 24 hours and 7 days a week. Establish a functional state-owned pharmaceutical company. Invest in young Black medical scientists and to do the groundbreaking research that is focused on what our direct demands are and not what is decided for us by the FDA and WHO. Regularize and fully integrate community healthcare workers as full employees of the state. Fund the research exploration of the use of stem cell science for pharmaceutical and medical purposes. Build 24-hour integrated post-sexual trauma centers in all district hospitals linked to policing and detective directorates. Build hospitals in Mbizana, Tabanchu, Orange Farm, Manguzi, Makado, Babatin, Kuruman, Mokwase, Maspumelele, and other remote communities that travel for hours on end for medical intervention. And stop taking Bill Gates' money. We no longer afford to run our country based on the population aspirations of a killer. How do you expect to keep our people alive with money from a man who invests in death? The brazen disdain of our people is so rife in South Africa from the ANC that ministers are fighting court judgments that call for load shedding to not affect hospitals. We reject the report. We reject Minister Joe Pasa and his drum majority in the portfolio committee. We reject the ice boy of the Oppenheimers and the Ruperts, Mr. Ramaphosa. Thank you, Chairperson.
Thank you. Honorable members, I am not sure, we must verify table stuff about the translations. And I need to be assisted also. This is an order, honorable member, I'm speaking. This is a hybrid session, and I would ask of my table staff to please switch on because there might be reactions on the virtual platforms. As we proceed, please advise. I am told there's no, but what we had requested from members is that the parties should submit if there's going to be another language because we have too many rooms at the same time. And the NCOP is also having their own committees, so we might not have enough. So the indication was requested going forth. If you have not indicated that your speaker will be using another language so that we can acquire the translations, is going to give us problems going forward. Thank you very much. Mamhlengwa ngiyaxolisa isikhathi ngesakho.
Thank you, Honorable Chair. Honorable members, Minister of Health. Let me start by accepting this budget vote as an IFP. Section 27 of the South African Constitution guarantees all South Africans the right to access healthcare service. While the Constitution and the complementary laws provide the framework to guide the state in the meeting of obligation, our recent experience in response to COVID suggests that much more is needed to orientate the publicity-funded health system towards fulfilling the health needs of our population. Nowhere else is it more evidence that South Africa is most inequitable country in the world that through our health system, approximately 71% of the population relies on the state for health care provision, relies on the state health care provision. In comparison, as more 27% of the population is able to afford the cost of private care and institutional framework perpetuate this inequality. That's why the IFP support, because most of people are rely on the health care from the government. Budget followed the agreed upon the situation, the institutional arrangements that are already in place rather than drive the change that is needed. There is a need to refocus on publicity-funded health system, starting with the identifying and addressing the barriers to fair and equitable access to medicine, as we aim to do during the Presidential Health Summit over the past weekend. The healthcare budget has not been adjusted to account for the rising demands for the health service as well as consumer price and need inflation, which is projected at 4.9 in the 2023 and 2024 financial year. We urge the department to prioritize to the mental health needs, because in our country, there are more mental health needs rather than any other thing, and cancer as well as infrastructure. That's why the IFP supports.
Sithokoze Mhlonishwa. Mhlonishwa van Staden.
Thank you, Honorable Chairperson. Honorable Chairperson, the Presidential Health Summit that was held this past Thursday and Friday in Israel were nothing more than an ANC Congress in preparation for the 2024 elections. This whole summit were nothing more than a talent listen process, and it was not a consultation process. I have attended the summit online for the reason that all opposition parties in the Portfolio Committee on Health could attend the summit in person. All the presentations that were presented during the summit was done by government and the African Union and some other institutions. It might as well have been done in a normal Portfolio Committee meeting. All stakeholders in the medical industry, private and public, as well as all political parties represented in Parliament should have been afforded the opportunity to make an input about the problems in the health sector and to present solutions to these problems that are threatening the lives of our people on a daily basis in the public health sector. Then you can call it a health summit. This was nothing more than an ANC talk show. Every year, annual performance plans from the department and its entities are presented to the Health Committee. And every year we ask the same questions, but never receive adequate answers on the problems that is threatening the lives of patients in public hospitals. We are currently sitting with a decreased budget of 64.6 billion from 22-23 to 62.1 billion for 23-24. Service delivery in our public sector is currently non-existing. Patients complaining daily from inside hospitals, but they are lying there for weeks and months awaiting surgeries just to find it cancelled day after day for reasons that is either the unavailability of beds, medicines, doctors, or the air cons that have broken down in the theaters. Patients on the outside is also complaining of hospitals that cannot admit them to perform urgent medical procedures or treatment. Not a day goes by without receiving these types of complaints, and we are receiving them on a daily basis in huge numbers. The Eastern Cape currently suffers a huge shortage of chronic medicine across the province due to the non-payment of manufacturers. The backlog in medical procedures are worsening by the day. The Financial and Fiscal Commission reported to the committee, but compared to other countries, South Africa has the lowest number of doctors per 1,000 patients, as well as the highest number of patients per doctor. The situation is worsening as South Africa had a 0.79 doctors per 1,000 patients in 2019 and it decreased to 0.32 in 2022. The huge diesel bill of 685 million for the past financial year to keep the lights on in the hospitals is a huge worry. With a plan to install solar panel systems at clinics, it also is not clear in how the system will be funded and the security measures implemented to see to it that these panels or its components will not be stolen or vandalized. The fact that more than 178,000 children died in our state hospitals in the last decade is also a huge concern. Every year, we must hear in the committee that new public health facilities are being constructed or current facilities being revitalized, but we never see a report on these matters either from this department or the Department of Public Works. But regarding the draft, regarding the medical legal claims, it's still not clear what this bill will entail and if it will address the problem. A fact, but there is also a shortage of executive heads at provincial hospitals, especially in 6 of these institutions in Gauteng, can be seen as one of the reasons for poor service delivery at these facilities. The ANC must take note not to launch a witch hunt on private health facilities regarding the inspection of these facilities, but should rather close down facilities like Dora and Ginza, but is not fit for human use or medical treatment. When there is an amount of 1.5 million dedicated to the national health insurance, even with the uncertainty of what this model will cost for taxpayer and no finance model yet. Ek hoop van harte dat die agbare minister aan ons 'n werkbare en uitvoerende plan van aksie gaan voorlê om die openbare gesondheidssektor wat reeds afgesterf het te laat herlewe, sodat Suid-Afrikaners weer gesondheidsdienste van hoogstaande gehalte sal kan ontvang. En nee, die nasionale gesondheidsversekering is nie 'n plan nie, dit is 'n ANC nasionaliseringsaksie. Ons soek vandag oplossings en uitvoerbare planne, want Suid-Afrikaners sterf daagliks weens die regering se onvermoë om gesondheidsdienste te lewer. Ons kinders, gesonde mense en ons bejaardes sterf in hierdie geriewe op 'n daaglikse basis weens hierdie regering se nalatigheid en slapheid, en Suid-Afrikaners soek oplossings en hulle soek dit nou. The citizens of this country are fed up with this government. The citizens of this country will no longer pay the price for this government's incompetence, maladministration and mismanagement the citizens of this country will be sending the ANC home. Your time is up. President Nelson Mandela would surely have been deeply disappointed in your actions and the manner in how you treat South Africans in our state facilities. The ANC must go home. Thank you, Chairperson.
Thank you. Minister, if I may ask, was that good? Okay, then we are fine because it indicated that you'll be speaking in Afrikaans. Let's get to that. Honorable Suker, yes, he said, no.
Honorable Chairperson, the ACDP addressed a number of issues during the health budget deliberation. Firstly, the need for an urgent response to malnutrition by this department. We called for a report on the 7.4 billion rand loan for COVID vaccines. We called out the state of emergency services and availability of ambulances in the Northern Cape and the need for the upscaling of the Richmond Hospital as an emergency unit to cover the N1 National Road. It is our contention that the budget presentation does not address the health care crises we are in. It is an inadequate response to issues raised by committee members who are faced on a daily basis with the reality of a health department that metaphorically is a sick patient on life support. The Department of Health has not responded to the ACDP's call for a response on severe malnutrition, a pandemic that is growing in our nation. Die droom van ons land Suid-Afrika is aan sterwe in die hongeroë van 'n kind wat suikerwater en brood eet as 'n maaltyd. 20.4% van gesinne beleef voedselonsekerheid. En jy hoef net te ry uit die Kaap deur die Karoo om die toename in honger te sien. Ons het meer en meer kinders wat die simptome van wanvoeding toon en vertraagde kognitiewe ontwikkeling. Die navorsing dui daarop dat ons dringend intervensie moet neem en dit nou ons pandemie is. Die impak van honger op die gesondheid van kinders in die langtermyn is permanent, veral in die delikate fase van kognitiewe ontwikkeling en honger het 'n negatiewe impak op die geestelike gesondheid van mense, nie teenstaande ouderdom. The ACDP sees the impact of child hunger in the projects that we are involved in and the need for an effective and urgent intervention in communities where unemployment is high. It requires an interdepartmental response between health, social development, and basic education, and not at the glacial pace unique to the public sector. We need an urgent response. Food insecurity remains a major health threat in South Africa. Hunger increases the risk of drug addiction in children as young as 6, and vulnerable children sniff glue to combat hunger. We need urgent intervention in provinces like the Northern Cape, the Eastern Cape, and in the Karoo. Nationally, the increase in food prices are having major impact on the health and wellness of families in the lower and lower middle class categories. A call has been made from the NGO sector for food retailers to forego their markup on essential food items like eggs, and for those essential nutrient items to be reduced in price. Today, the ACDP wants to reiterate our support for this call, and we join the call for government to provide a legal framework to ensure food products that are rich in nutrients are reduced in price to combat the growing crises of hunger and the health
Thank
threat
you very much.
it poses to vulnerable groups. Hunger is the disease that we can cure. Thank you.
Thank you. We now recognize the Deputy Minister of Health, Dr. Ndlomo.
Thank you very much, Chairperson. Oh God, we want to greet the Minister of Health, Dr. Pasha, greet all the MECs present here, MEC Limpopo, MEC Northwest, MEC Mpumalanga, and those who are logged in virtually, our National Assembly honorable members. Also want to greet the DG who's here present with his whole team. I want to specially dedicate my talk to the 20 nightingales, among them Mama U Rosemont Tunyiswa Shabane, who was laid to rest on the 22nd of April, this 2023, as we'll be celebrating the International Nurses Day on Friday. This is a group of 20 nurses who were recruited by the African National Congress under the leadership of President O.R. Tambo to go and assist Tanganyika, now Tanzania, when the white nurses migrated Tanganyika then, because they were not going to be able to serve under a black government in 1961. These nurses are returning home and some of them have been laid to rest. So we want to also thank the government of the Eastern Cape for actually getting a special provincial official funeral for this lady. The recently approved National Strategic Plan for the Prevention and Control of NCD, non-communicable disease, will accelerate the country's response to the challenges of the NCDs, as some of the members before me has indicated. The National Communicable Disease Campaign has been established to strengthen the district community-based responses in line with the integrated people-centered health services approach that we do have. This plan therefore endeavors to lay a foundation for the action through a cascading strategy similar to that the minister has alluded to of 1990 that we use in HIV, TB, and AIDS. But this one, we want to start it at 90, 60, and 50, meaning that 90%, including us here, 90% of us here should know whether we do have high blood pressure or not, and also diabetes. And of course, after knowing, 60% of those should be able to get into knowing the interventions, reducing your weight, exercise, stop smoking, stop drinking, or start the medication. And 50% of those on those interventions listed above should be able to be under control. Now, we have put a target in the country of at least doing annual screening of 25 million people. We really are happy with the target that we overshot last year by screening 32 million South Africans on high blood pressure and 31 million for diabetes. However, we fall short of making sure that those who have been established are able to follow the instructions that have been given to them. However, we are rolling out this program through the leadership of the minister of actually at the point of care, provide and test for glucose through the HbA1c. And we want to accelerate this program very strongly. I want also to say I have been taught by one of the young Cuban doctors who have qualified in Cuba, Dr. Nhlakanipho Gumede, who is a senior manager at Grace Hospital, who has actually given me a classification of all individuals within the country from 1 to 5. Because of time, I'm not going to be able to do all that, but this classification is empowering healthcare workers through a multidisciplinary team to be able to sit down, look at the data that they collect, and plan the urgent intervention for a family and for a society. Now, we are going to go very strong on this because we do need, among other things, to respond to some of the things that Honorable Clark has said, that we are not very strong on NCD. We will be. There's a very innovative program in our country called CCMDD, which was started by this department very innovatively. And it's assisting us to really make sure, and it is like a shortcut for many of our South Africans. Currently, there is over 5.6 million who have been registered to the CCMDD. What is the CCMDD? It's patients who are no more who are not supposed to go to the clinic every month, but then actually get their medication at home, collected in the crèche, a school next door, or in a shop next to them. Now, this is assisting them that in cutting down in terms of going to the clinic 12 times a year, they go 4 times. The rest of the month, they come medication close to them. So while we have not been very strong in actually improving our healthcare personnel in clinics, we really benefit from not them crowding our clinics because we take medication to them at home. This is assisting us even strongly to improve their adherence to treatment and also making sure that we don't lose out in this process. We actually, I was told by DG there, I hope this is true, and it is, that we have been awarded through a African Association of Public Administration an award in Africa for actually being able to get this process on. On mental health, safe to mention that we had a successful SA mental health conference 2 weeks ago, hosted by a department, Our minister spoke at length there, and therefore it is actually showcasing that we do indeed acknowledge as a government that maybe this program has not been one that we are focusing on. So we especially had 2 days working on it and also putting up a program, how we are going to run with this process, where we could actually decentralize all of our healthcare workers to move on from being just generalists, but to get some knowledge of mental health and be able to intervene. Because some of the criticism is that in our facilities, in our clinics, we are not able to support and work and give support to those who need this process. There is a very good campaign this department is doing, and we want to accelerate it on human papillomavirus vaccine on young girls in schools. Minister, we have not briefed you about this. We have been approached by private schools to say, we don't want to be left behind. This must also encompass us. Parents from these private schools have got medical aids, so this vaccine will be paid by their medical aids, but they want to see us involved and working and supporting them. We are ready to take this up. Minister will give you that support to say all children in this country, so that one day we report that there is no reason for us to continue screening on the cancer of the cervix because we have already eliminated it. In partnership with the Department of Home Affairs, we have actually installed Home Affairs offices in 1,445 of our health facilities in the country. Now, I'm calling Minister, our hospitals now, they offer B&B. They offer a baby and a birth certificate. When you get in there, you don't have to go elsewhere. You deliver a baby and next door, you get a birth certificate. Now, we want to roll it out because there's a call in the country to say everybody should be registered. All births should be registered at least within 30 days. Any 30 days later is a late registration. So we want to accelerate this process of getting birth registrations in all our facilities. I am told the DG is working also in the possibilities of getting the death certificates collected also online in hospitals. That's going to really take a huge burden from the anxiety that we do have in our country. Minister is a chairperson of a program called E8, Eliminate Malaria in SADC. Now, we are aware as South Africa that there's a heavy burden on us as a country because we don't have malaria all over. We have malaria in 3 provinces, Limpopo, KwaZulu-Natal, and Mpumalanga. And even in those provinces, not all districts have got malaria. So there's an expectation in SADC that Minister Phahla and the team must do faster and better. We are really glad with the progress that we are making because we already got an award also last year from WHO recognizing our efforts that we put on the eliminate malaria processes. However, we were not happy with the slight increase of morbidity and mortality last year. And I note, Minister, when I asked about this, we were told it is due to some challenges that we did have at the border screening. So we would like to improve on that so that you could report better into SADC structures. I want also to talk and support and get our colleagues here, mainly from the opposition, to give us evidence if there is. Because I can say we have improved so much in terms of placing interns and medical community service doctors on time. And there are doctors who may remain unemployed because they don't want to go to Chilizini Hospital. They want to go to Para Hospital. If we have closed all intern posts and community service posts at Chris Hani Parakwana Hospital, then they must go to Da'a and Chilizini, but they remain unemployed at home and they work for the next round. So I would want to have evidence that we continue not placing doctors rather than those who are waiting for the next round because they prefer to work in urban areas and they don't want to go and assist us in the rural areas. This, since this inception of this program of Fidel Castro Nelson Mandela program 1997, we have graduated 3,027 doctors. We would like to, thank you very much on that. We would like to invite honorable members to join us on the 7th of July, where we'll be graduating another 410 of these doctors in partnership with the University of Cape Town. It's unfortunate that we'll do this in the University of Cape Town and there will be no child who will be graduating there from either Mbekweni, Khayelitsha, Gugulethu, or Mitchell's Plain, because this province has not really taken up on this program of Fidel Castro. That is why Minister has instructed me to work with the Minister, Deputy Minister of Higher Education, maybe to get some funding to come and identify children from the Western Cape who must also benefit from this Cuban Mandela process program. Yeah. Now, the Cuban medical training has a primary healthcare approach, and is a department we have started the discussions with the local medical universities to ensure that the medical training in South Africa has a strong primary healthcare arm using the Cuban model, which has been proven to be very effective. I want to say, Honorable Minister, we have really worked hard as a tripartite departments. The departments led by 3 deputy ministers, Deputy Minister of Mineral Resources and Energy, Deputy Minister of Employment and Labor, and myself, tasked by our government, Honorable Cyril Ramaphosa, to actually run the program of ex-mine workers program. We have had successful campaigns and visibility in KwaZulu-Natal, Eastern Cape, and Northwest. Our next target is to go to the rest of the country and also in SADC. What is happening there? Because you happen to be a black mine worker, you left the mines without your pension payout and the rest of the other issues. Occupational diseases were not checked if you are black. Now we are actually accelerating that. All former mine workers who were white are sitting at home enjoying their pensions. But the black ones, we have to go and look for them in Gqeberha, everywhere, all over rural areas, and get them to be supported. And we will do that, we'll continue to do that, because there's money, 10 billion rand is sitting there waiting to be compensated to these mine workers, and they are actually not having their monies on it. Now, the last part that we want to talk to, we want to acknowledge the fact that 461 very small aperture terminal broadband services have been successfully installed at the critical health facilities, health clinics in particular, by our ministry and the Department of Communications and Digital Technologies at the end of 2021. We acknowledge the effort and commitment from this department, our sister department, Department of Communications and Digital Technology, in providing connectivity, equipping these critical centers with connectivity infrastructure required to tackle all our diseases. The rollout of our services across remote regions as the country has been accelerated. It has also been greatly improved. It has greatly improved the medical services and provisions of access of all our patients. So we want to actually go very strong on this. We would therefore want to say we are grateful for those members of the portfolio committee who have come in here to support our budget, and I would like to say, Chairperson, the 2 minutes remaining, I would like to give it to my minister when he closes. Thank you very much.
Thank you. We now, I'm very aware, even the minister has left some minutes, I know, I have them recorded. Do we have a member of the UDM on the platform? A member of ATM, Mr. Zongola, your name is given.
Thank you, Chair. Can I proceed?
Yes, proceed.
Thank you very much, Chairperson, for the opportunity. The Department of Health is crucial for the well-being of the country. Access to quality healthcare must be top priority. The poor citizens of the country can't be condemned to poor quality healthcare and the West having no access to healthcare at all. We cannot in this day and age have patients die on hospital beds or benches due to lack of oxygen, medicine, and other medical supplies. At minimum, all hospitals and clinics should have basic necessities such as water, electricity, oxygen tanks, syringes, medication, and sufficient doctors and healthcare workers to render services on a daily basis. Minister, there's been a rise in issues concerning mental health, especially amongst young people. The department must be able to devise mechanisms to help young people in this regard. Mental health care facilities should be made more accessible. Selling fake and expired food to people is akin to biological warfare. This is even worse because these fake and expired goods are only sold to vulnerable, poor Black communities. South Africans are in desperate need of food quality assurance to ensure that the food sold to them is safe for consumption. This is similar to the issue of bogus doctors who have got no legal authority to prescribe medication or even perform even the most minor of operation. These doctors are operating in poor Black communities and experimenting on our people. To this point, the department needs to have a wide-scale crackdown on all unregistered doctors masquerading as registered medical practitioners. The department needs to make it worthwhile for our doctors to practice in hospital located in villages. Currently, healthcare workers are frustrated as they're expected to be of service to communities, yet hospitals and clinics do not have these basic necessities, as some leaders misuse public funds and do not equip clinics and hospitals. There is a need for psychological support for healthcare workers who witness trauma and death on a daily basis. Essentials such as sanitary towels should be made accessible for women, especially those who are underprivileged. Sanitary pads are not a luxury, Minister, they are a need. Minister, there needs to be an increased training capacity for healthcare workers. Remuneration packages need to be reviewed. Disease prevention needs to be prioritized, and community-based health services needs to be strengthened. Nursing norms need to be reviewed to allow for quality healthcare. Clinical education needs to be prioritized in order to have nurses ready to function independently after basic training. And lastly, the health department needs to put pressure on Home Affairs to deal with the issue of undocumented migrants who add to an already heavily burdened public healthcare system. I thank you.
Thank you. The Honorable Sheikh Imam.
Thank you, House Chairperson. It is not the policy of the National Freedom Party not to support a budget vote, simply because we have to deliver services to our people. However, having said that, to the Minister, Deputy Minister, Chairperson, and I think for all the colleagues that have spoken, I think we all know and understand the challenges that we face as far as healthcare is concerned in the country. I remember the words of the former Minister of Health, Honorable Minister Motsoaledi, when he said, you know, I could go out throughout the country and dish out dialysis machines, but that is not what I want. I don't want my people to die with kidney failure. I want them to live longer and healthier. So the question we need to ask today, what are we going to do in this country to move to a more preventative healthcare system? I think that's where our focus should rather be on. Now, remember, Honorable Minister, through you, Chair, this country's got a population increase of over 1 million every year. And they say you are what you eat. There is very little or no focus on the food products that are sold on the streets, giving rise to the high burden of diseases in this country. And I think we should start focusing on prevention rather than cure, if that's the term I should actually use. If you look at the Cuban principle and the policy that they follow, and we are sending our students here to go and study there, it must be to introduce the preventative system so that our people can live longer. And let us not forget, people are starting to die much earlier now. You're having people at 25, 30, 35 dying with heart attacks in this country. But on the issue of this mental health care, and I'm glad you raised it, Minister, I'd like you to take your team and go and visit RK Khan Hospital, where psychiatric patients are currently being put in one room, both male and female, no ventilation. It's a psychiatric ward. Can you imagine what you can expect if something goes wrong there? But very importantly, there seems to be an outcry from those that have studied abroad that are writing board examinations. Appears to be there's a lot of allegation at this stage of corruption, that people are getting passed and those are getting failed because there's money changing hands. And the other problem, which I think I addressed to you, Minister, is the issue of medical practitioners, those that have served their community service, but cannot be accommodated. And if you want the NHI to be successful, we're going to have to accommodate these people. So my plea is, can we take care of our citizens by creating a preventative healthcare system? I thank you. The NFP will support this budget vote. Thank you.
Thank you. The Honorable Fava.
Thank you, Chair. To the Portfolio Committee members, the Minister, the Deputy Minister, the people of South Africa, and in my region, first Ledabi people, Mafube, and my hometown Villas, including my family. Warmly greetings. Yeah. Chair, infrastructure plays a critical role in supporting the core objectives of encouraging better care standards, patient well-being, and ensuring that health users have a positive experience with healthcare system. In addition, the healthcare system and its personnel must encourage general public to prevent illness, promote good health and healthy lifestyle as part of agenda for improving human health. As such, infrastructure plays an important role in strengthening the health system and ensuring that issues related to access to quality and affordable healthcare are always prioritized. Infrastructure development is a key element of economic reconstruction and recovery plan, thus contributing to job creation and economic development. As a developing economy with one of the largest health systems in South Africa, it is important and incumbent upon us as a country to prioritize health infrastructure towards obtaining improved healthcare outcomes and healthcare development goals. This, however, should be understood within the context of global events that have and will continue to see an increased urbanization as a result of greater increase in migration patterns to South Africa, internally and externally, and this places a burden on social services, including healthcare. In previous week at the Presidential Health Summit, the issue of healthcare infrastructure was tackled, with much emphasis being placed on the importance of strengthening financing model for the healthcare infrastructure. This, of course, in light of the 10-year infrastructure plan that includes strengthening health infrastructure as integral part of improving primary healthcare, as a consequence, creating a platform for the implementation of the National Health Insurance. Having mentioned this, Chair, Honorable Chair, on the Presidential Health Summit, I wish to indicate that the Deputy Minister, in front of the President, when the whole country was also watching, mentioned the pledge with regard to universal healthcare coverage. I will specifically mention one pledge on point 9, which says, you become an advocate of universal healthcare coverage within communities and create awareness of benefits of universal health coverage. This I'm mentioning on the fact that Honorable Member Clark was here. When this pledge was being read, as all members were, they were saying, yes, I do. So the DA, it is within marriage with us to implement this. He was there. You can go to the Hansard, he was there. So I wish to mention that we are obliged to have such honest portfolio members that are confirming the pledge to say we'll go together with them. Thank you. The infrastructure development goals have, however, not been without challenges. This particular, as it concerns the reality and context of the COVID-19 pandemic on the hand, and the national crisis of load shedding, insofar as it pertains to infrastructure development within the healthcare sector. There's a need, indeed notable impact on developments within the health sector in this administration. These among things hampering on the quality of services that can be provided for users of public healthcare system in South Africa. In the previous year, particularly, as part of the oversight responsibility of the Parliament, the Health Portfolio Committee conducted oversight facilities in Eastern Cape where there is certain areas of good quality healthcare service provision. And in some areas, there have been notable changes regarding healthcare service, particularly as it pertains to quality of health and infrastructure sector. We met MEC Meth by the Presidential Summit, as the Portfolio Committee will be doing the follow-up to Eastern Cape, and she was very pleased to invite us to the UP to see improved infrastructure of hospital there. So we are proud to say the ANC government delivers. Thank you, MECML. It is thus important that this budget cycle should explore and consider strengthening the capacity of health facilities. There is already work that is underway that is led by the Treasury and National Department of Health. Within a budget of 22.2 billion over the medium-term expenditure framework period, The direct health facility revitalization grant is the largest source of funding for public health infrastructure. It is distributed to provincial departments of health through health facilities infrastructure management sub-program of the hospital system program. The 66.9 billion national health insurance direct health facility resolution component is housed in this sub-program. It includes funding the planning and construction of the Limpopo Central Hospital in Polokwane, which is scheduled to open in 2025-26. Equally important, it is the question of health technology as a purview of infrastructure. South Africa being one of the advanced countries in the countries, it pertains to health research. It is necessary to consider the work that is undertaken by some of the department entities that deserve overarching agenda, improving healthcare system and health services as a whole. Some of the evidence in this regard is noted that some of the science research that is being leaders in health fraternity is a global event. Shouting like or a EFF don't assist, here are the facts. Over medium term, it is anticipated that the council will spend around 24.8%, 1 billion on innovation and technology programs that aim to improve health. That includes developing ability low in middle income nations to produce mRNA vaccines, funding scholarships to develop workforce for vaccine production and monitoring COVID-19 RNA wastewater across more than 80 wastewater treatment facilities in South Africa to ensure that COVID-19 outbreaks are caught early. Whilst the sector is confronted with various challenges and need of structural reform and transformation, it is however important that the Marshall Department of Health and Ministry, that the nation will remain, of course, in terms of dealing with the need transformation in light of the other geopolitical and social issues. Honorable Vice let's make it clear on the following, on the matter of elections. The president had said, this election is ours. We are hard on the ground on with service delivery in the year of decisive action. Ours is not coalition. Outright majority is a victory, and we are on course, and victory setting. I thank you.
Thank you, Honorable Baba. Do we have a participant from the AIC? Order members? Do we have a participant from the AIC? From COPE? From PAC? None. We have a name, the Honorable Hendricks Aljama. You? Do we have a participant from the PAC? None. Honorable Wilson, it's your time.
Thank you. Humpty Dumpty sat on a wall. Humpty Dumpty took a great fall. All the king's horses and all the king's men couldn't put Humpty together again. Yes, it's an old nursery rhyme that tells of an egg falling off a wall, cracking, smashing as it hit the floor. And all the king's horses and all the king's men had no idea how to put it back together again. It is the perfect example of what has happened to the South African health sector in recent years. Humpty is health. It has fallen, cracked, and broken, and none of the president's men know how to fix it. And while the president's men stand by and scratch their heads, the increasingly poor and vulnerable South Africans bear the brunt of a broken health system. You are indeed, by your own admission today, Minister, falling behind. Where does one even start to discuss the brokenness, let alone of how to fix it? You have to understand how it broke in the first place. Let's start with corruption. It is over a year since Babita Dearkaran was gunned down for exposing the deep corruption and ridiculous overpricing of goods supplied to the Tembisa Hospital. Over a year, and the matter is still under SIU investigation, And to date, not one of the companies cited in her expose have been blacklisted by the department. So the corruption continues unabated. Medical negligence claims have run into billions. Complainants are winning cases on the fact that no files or information can be found at hospitals. But it is now clear that the doctors and the senior personnel are complicit in some of these claims and working with unscrupulous lawyers, stealing files and falsifying information, and they're getting away with it. Why? Because of the short staffing and impractical record keeping and storage of information. It has also become abundantly clear that state-employed doctors spend more time in their private practices than in the hospitals that they have been employed to serve. Can the president's men put it together again? Not likely. Between the corruption, legal fees, and loss of suits on medical negligence, millions and millions of rands have been lost to health departments at the price of quality health care to the poor and to the vulnerable. Health is broken, and the president's men cannot fathom how to put it back together again. One of the president's men, the minister himself, revealed a backlog of 7 years for orthopedic surgeries, which include fractures, knee replacements, and hip replacements. People are being forced to live in unbelievable pain and often end up with walking aids and wheelchairs. They cannot function optimally, and some have lost their jobs as a result. Cancer patients requiring mastectomies and other cancer-related surgeries will have to wait between 1 and 2 years for life-saving surgeries. It is common knowledge that in order to arrest the spread of cancer, biopsies and removal of tumors and masses must be done as quickly as possible. Life expectancy of cancer patients is seriously affected. It is a terrible state of affairs, and those that could have had good lives if treatments were done immediately are being denied this. Hysterectomies can take up to 2 years, cataract removals 3 years, and the list goes on. Humpty's health fell off the wall, and the president's men together cannot put it back together at all. Section 27 of the Constitution deals with healthcare, food, water, and social security, and states clearly that everyone has the right to have access to healthcare services, including reproductive healthcare and surgeries and cancer treatments. It further states that no one must be refused emergency medical treatment, but they are. In terms of Section 9, everyone has the right to equality, including access to healthcare services, which means that individuals should not be unfairly excluded but in the provision of healthcare. That includes EMS, cancer surgeries, and orthopedics. I say to you, the president's men, people are being denied reasonable access to life-saving surgeries, and the denial of quality of life is being done, as in the case of orthopedic and other critical surgeries. Millions have been spent on the National Health Insurance Bill, with failed pilot projects, public hearings, and the appointment of staff for NHI. This money could have been used to upgrade facilities with staff and infrastructure to avoid this crisis. The president and his men are trying to put health together again with NHI. It will not stick. The bill is clear. Only those hospitals and facilities that meet compliance standards can be included in the NHI. May I say to the president's men, you cannot pass the bill. The majority of hospitals and clinics in the country are not compliant. The Office of Health Standards Compliance, by their own admission, advised they cannot get to all the health facilities, not for years, due to the lack of staffing and resources. So what then, president's men? If you pass this bill and continue without health being compliant, you are going to breach the very bill
Thank you
seek
very
to pass.
much.
You will face the consequences.
Thank you.
Be sure.
Megela, sebaka ke sa hao. I will pretend as if I didn't hear you, Honorable. Honorable Clerk. I know it's your norm. It's how you behave, even in the portfolio committee. Thank you very much, House Chair. House Chairperson, Honorable Minister Joe Patla, Honorable Deputy Minister Spongiseni Dlomo, other ministers and deputy ministers present, my chairperson, Honorable Kenneth Jacob, my fellow members of the Portfolio Committee, honorable members of the House, but especially my fellow comrades from the glorious movement, the African National Congress. Honorable MBCs for Health who have just joined us today, it is a pleasure to have you. Greetings to my beautiful MPCs, my comrade, my mother, Umamuno Mantu. I'm happy that you are here. Chairperson, the World Health Order, Organization. honorable members. Proceed, ma. The World Health Organization, which provides us with the definition of health, which is, says, I quote, health is not just the absence of disease or infirmity, but it is the state of good physically, social, mental well-being, and that the attainment of the highest standard for health is the most important worldwide social goal. Those realization needs action from other sectors, economic and social addition to the health sector, close quote. You can see, Honorable House Chair, honorable members, that the definition even mention economy as just one of the sectors that are also relate on health. Honorable House Chairperson, let me demonstrate how important health is in our life. Without health, economy does not exist. Without health, education does not exist. Without health, sport does not exist. Without health, peace does not exist. Maybe let me bring it a little closer to home and say, without health, parliament does not exist. And we all know that, honorable members. Therefore, House Chairperson, this means that we must invest in health. We do the budget in the country. We must prioritize health. Health must receive the biggest funding than all other sectors, because without health, we are nothing. As the President of the Republic, President Cyril Ramaphosa said this just Friday when he was addressing the Presidential Health Summit in Joburg. He said, and I quote, "We need well-funded health system moving forward as we introduce our NHI. We must all insist that our healthcare system must be well-funded," close quote. Chairperson, improving health outcomes as an imperative for strengthening the South African health system. It has been globally declared that we are now on the other side of the COVID-19 pandemic, which over the past few years changed the world as we have known it, but also more important, changed the sector globally. Throughout the period of the pandemic, the South African health sector has evolved, with our country also gaining globally recognition for its leadership in health, science, research, and development. The COVID-19 pandemic also posed a challenge for some of the strategic health goals that the department had set for this administration. This is seen in how some of the programs' performance over the past few years experienced some setbacks. This including the areas of maternal health and youth health, HIV and AIDS, as well as in the area of communicable and non-communicable disease. Although the country and the world is confronted by economic challenges that further apply the poor in
into the position of vulnerability. The South African government, as inspired by its commitment to the people of South Africa, maintains its position of prioritizing healthcare, and particularly ensuring that the NHI remains the vehicle which should be used in order to achieve the health justice in our lifetime. As integral a part of this is indeed a resource allocation for health priorities such as maternal and child and youth health, HIV, communicable and non-communicable disease. Prioritizing the issue of youth blood as it relates to HIV is vital and is a critical aspect in the attainment of NAIDS 95 strategy. The department is giving adolescents and youth a friendly service, which is anticipated to improve how young people access the health services. Top priority in addressing some of the barriers to receive sexual health treatment. This budget vote enables that implementation of the development initiative Create Youth Zone aim to ensure that these adolescent and young adult friendly services are included in the suite of primary healthcare services. The youth zone support the political call for enhancing everyone's access to health care and era to a strategic avenue wherein issue such as the promotion of access to health and also other services, public health promotion, and ensuring that health facilities are free from stigmatization, especially for youth and other vulnerable groups. The HIV and AIDS and STIs sub-program, the communicable and non-communicable diseases program, has been allocated 24.6 billion throughout, with the HIV and AIDS and STIs as a component being the largest. The main focus of the components funding is antiretroviral therapy, which will reach 7 million individually by 2025-2026. There are also sizable budgetary allocation for preventative initiative like condoms distribution, medical male circumcision, and HIV testing. This is indeed a significant step that will provide for overall improvement of health outcomes over the health system. Regarding communicable and non-communicable disease, the budget vote strategically identifies the areas that need to be prioritized over the MTF term in this, including reducing the risk of women developing cervical cancer by 80% of eligible girls in grade 5 against the human papilloma virus in each year over the medium term, contribute to the reduction of HIV infection among young people by ensuring that 2,300 primary healthcare facilities have youth zone, achieving TB treatment success rate of 95% by 2024-2025, increasing a total number of HIV positive people accessing antiretroviral treatment from 5.2 million in March 2022 to 7 million in March 2026, implementing the universal test and treat policy, reducing new HIV infection by implementing a combination of the prevention or intervention such as HIV counseling and testing, medical circumcision, and condom distribution over the midterm, reducing premature mortality as a result of non-communicable disease, screening 60% of clients of hypertension and diabetes in 2023-2024. We need to continue to strengthen the health system through increasing human resources capacity of professionals, such as specialist doctors and nurses, in line with the increased training. The number of medical interns appointed by provinces has increased from 1,500 in 2015 to 2,625 in 2022, and community service doctors from 1,222 to 2,369 over the same period. The Mandela Federal Castro graduated over 650 graduates, which will improve positively in improving the capacity and quality of healthcare. One of the strategies that will enable this include the reorientate the health system towards primary healthcare through community-based health programs by ensuring that all community health workers are capacitated and supported. The department plans to improve the quality of care at primary health care facilities by ensuring that 2,400 of these qualify as ideal clinics by 2024 March. It is important to place emphasis on the importance of the strengthening the primary healthcare system as a way to improve the South African health system and build a more equitable health system and equal service as a people of this country. Chair, let me just respond in some of the issues that were raised by honorable members of this House, especially the opposition party. Chairperson, allow me just to say the ANC is being in power since 1994. It's true. We know that as African National Congress, but you must bear in mind, what have you done? Because you were leading since that era of apartheid, we were there. But as ANC, we have done a lot in terms of making sure that our people get services that they have to get. As ANC also, we are not corrupt. We are not corrupt. You are also corrupt during your era. You must go and check even here, the DA, where the DA is leading. There are also scandals that are there.
Thank you.
So you must not say ANC is corrupt. And we will continue to rule this country.
Thank you.
Thank you.
Honorable Minister, as you conclude the debate, know that you have extra 5 minutes and 50 seconds, which takes you to 10 minutes and 50 seconds. Thank you.
Thank you very much, Chairperson. Let me thank all the honorable members of this House who have contributed to the debate on budget vote 18, the budget vote for health. Indeed, I think if anybody had a doubt, there is no doubt that election campaign for 2024 is in full swing. Otherwise, some of the things, outrageous things which some of the honorable members have said, denying reality, wouldn't have been said. It's just a confirmation that indeed we are in a full swing of an election campaign for 2024. Chairperson, before I go on, let me take this opportunity to thank many South Africans, patriotic South Africans, who have given their time, their skills in serving our people in various capacities, some of them without even any remuneration, serving in various structures, as I've said, over the 3 years of the fight against COVID, various committees, over and above our frontline health workers, but also on a normal day-to-day work of the department. There are many South Africans who provide their skills, their time, some of them serving in the various boards, various councils, and contributing their skills to improve the quality of health of all South Africans. And I want to take this opportunity to also recognize and thank our health ombud, Professor Malakapuru Makhoba, who's on his last leg of completing his term as the health ombud. He came in here in an area which nobody had, there was no experience here to establish the office of the health ombud. Now, because it is a fixed term, a 7-year fixed term, he has to complete that at the end of May. we're discussing in terms of the handover, but at the current moment, in terms of the appointment, he's completing. And as we know, he has helped us quite a lot in terms of identifying areas of weakness. South Africans had confidence in reporting areas where they were not happy to his office, and life esteem just as one of very prominent areas which he has helped us to make a lot of improvements. I'll just comment on a few of the honorable members' inputs. Honorable Clark, I think it's a to the hundreds and thousands of very committed health workers out there, for them to hear you alleging that everything is falling apart. I mean, as we speak here today, you can go to all 9 provinces. You can go to our clinics, you can go to hospitals, big and small. You will find dedicated health workers busy saving lives, bringing lives and saving lives. On an average, I just mentioned, for instance, that, on a daily basis, I mean, if you go to a hospital like Chris Hani Baragwanath Hospital, you have over 7,000 workers on a daily basis working there. And on a monthly basis, delivering between 1,500 to 1,800 babies alive, coming to life. So if we were to check how many of the young people, not just in Gauteng, but all over, who actually can attribute their life of coming to life to many of our public health facilities, for them to be hearing from you that everything has fallen apart. I mean, really, I think you have to really think again before making such outrageous statements. We acknowledge that there are challenges. We have said it here, that our system is under a lot of burden because of high burden of disease, because of underfunding, under-resourcing, but those are the issues which we acknowledge and we're addressing. In terms of the area of corruption, a lot, we acknowledge also that it is a problem, but we're dealing with it. If you correctly say you were at the presidential summit, I'm sure you would have had Advocate Mutibi reporting the number of cases which have been dealt with, some of which have been referred to the police and to the courts. And a very Tembisa issue, as we speak, MEC is here. When we break here, you can talk to the MEC. She can brief you. The action which she has taken, the CEO is still on suspension, is facing charges. So there's action being taken. We're not shy away from where we have challenges, but we're acting. Of course, Honorable Chirwa, as usual, what else can you expect? Just, fury and with no sense, as usual. I mean, to say that the NHI is a sellout to business. Really? Have you even read it? Have you read the bill itself? Have you read the white paper? Have you read the policy? This is the antithesis of privatization. That is why, as we sit here, as we go through this, we are under no illusion that big business, those who are making millions out of the health and the sickness of our people, will be running to the highest courts of the land. That is exactly why this is to undo all the way in which many South Africans, including honorable members here, or even honorable members here on a daily basis, complain about the high cost of private healthcare, the profits which are being made, and this is essentially the antithesis to that. So I will say to the honorable, anyway, not surprising. I don't know how many times, various chairs have had to eject her from meetings because of the nature in which,
On a point of order, Chair. On a point of order, House Chair. On a point of order, House Chair. No, it's my right to have a point of order. On a point of order, House Chair.
Honorable Ntlangwini, we are very few in the house. You just raise your hand or stand up. You don't just go to the mic and start.
That is our point
Okay.
of order is called,
No, we are
Chair.
very few. I can
No,
see you.
no.
Please,
You will not
let's
see
follow
me.
what is, let's
You wouldn't
follow
have
what is
seen me.
happening.
I'm following the
No,
rules.
don't
I'm
talk
following
back.
the rules.
Don't talk back. Please, what is your point of order?
You know what the minister just said? It's precisely why we have raised letter against this bullying of Naledi.
Okay, thank you very much. Thank you.
We have submitted. letters
Honorable
against
member,
the
this is
bullying.
not a disciplinary
attend to that.
hearing and that
We'll
is
attend to
not
that.
a point
That
of
day will
order.
come.
Please,
We'll stop bullying
please,
her.
please, that's not a point of order. Proceed, the honorable
Thank you
member.
very much, Honorable Chairperson. Mama Hlengwa, just a small correction. You said that 70% of South Africans depend on public health. It's actually much higher. 85% of all South Africans are depending on public health. So that's why to us, this is a matter of life and death. We must defend this public health because this is the lifeline of 85% of South Africans. And let me just add, many of us also here who have PAMED and other medical schemes, in a few months' time, it will be exhausted. When you go there and say you want to buy some medicine and whatever, you go to a GP, they'll tell you it's exhausted. Where do we go? We go back to the public health. So it's much, the dependence on public health, it's much higher. And we agree also that we must attend to a number of issues, including mental health and cancer. Honorable Van Staden, if you want the report, I don't know whether he's gone now or he's here. If you want the report.
Order, members.
If you want the report on completed infrastructure projects, we will come and report. You just have to talk to the chair of the committee, put it on the agenda that we did a report on all completed projects. We will be able to give you. Honorable Sukas, I'm happy that you've elevated the issue of nutrition, malnutrition so high. I don't see Honorable Sukas. Oh, she's there. But this is an all of government and also all of society matter, because malnutrition, to prevent and eliminate malnutrition is not only the health portfolio which must deal with it across the board. Correctly, as you said, the cost of living is rising. So we accept the fact that it's an area which indeed you are correct in saying that some of the damage can be, for life. In terms of stunting, in terms of mental, the development of the brain. So that's an area which we need to, and of course, government has rolled out various nutrition programs, correctly so. Yes, we know some of them have stumbled. Well, you only become conscious of it when it stumbles. But in the normal day, millions and millions of children are being fed. Only when there's a stumbling on one particular area, then you become conscious because to you it's just a politicking. For those who benefit from this, it's not just, they don't just focus on one day when the program is stumbled. On Honorable Zungula, we agree for the first time, I'm sure, agree with you in terms of the area of supporting mental health and also including also for healthcare workers. Honorable Sheikh Imam, indeed, prevention is better than cure, and we are working very hard to make sure that we not only benefit from the training of our young people to be doctors in Cuba, but the system, the preventative system of Cuba that we must embrace as a country. Of course, Honorable Wilson, always a dramatic. You have to look in between the drama to try and see the sense. Of course, we have never denied the fact that there are backlogs. We have never denied the fact that, as I've already said, that we are dealing with litigation. You don't even go ask yourself, why are there backlogs? The backlogs are because, amongst other things, there was a disruption over the last 2.5 years of normal health services. Secondly, the health system is overburdened by various issues which can be solved by health. The fact that there are dozens and dozens of people on a daily basis injured in motor vehicle accidents can be solved by, it's a social issue. It's us, all of us in society must make sure that we reduce drunken driving, violence in communities. It's not the issue or just which can be solved by health. All of us must work together to reduce the backlog in terms of the pressure on our health system. We want to say, as I close, Honorable Chairperson, that we take our work very seriously. We know the challenges, we are aware of the challenges, but we also aware that this is the mainstay of provision of health for the majority of South Africans. We must look after it. And I'm very happy to say that we have a very
Time
committed
is
team,
now expired.
both at national and also at provincial level. Thank you very much.
Thank you. Honorable Wilson, asseblief. Agoyehle. Members are reminded that the debate on sports, arts and culture budget vote will take place at 14 hours in the Good Hope Center chamber. And the debate of employment, labor and budget vote will take place at 14 hours in committee room M46. Honorable members and our honorable guests, the MECs from Limpopo, Mpumalanga, Gauteng and Northwest, we really appreciate your presence here. That concludes the debate and the business of the mini plenary session, and the mini plenary will rise. Thank you.
Long live Chair, long live.